commercial perspective. Thank you for your presentation. And now we're on to our final presenter within this panel. Today is Kiran Sangwan, Executive Director for California Pan-Ethnic Health Network, to discuss test access issues. And we thank you so much for your patience as well. Welcome, Ms. Sangwan.
Thank you, Madam Chair and members. Thank you for the opportunity to be here today. It's been really interesting to listen to also all of the other panelists and some of the work that's happening to move us forward. I'm the Executive Director of the California Pan-Ethnic Health Network. We're a statewide multicultural health advocacy organization. We work with communities of color to advance health equity and address persistent health disparities. And I do want to say, I think we see a number of issues with regard to health equity in this crisis, and have been asked today to focus on testing. Happy to do that, but also really want to acknowledge some of the issues that have been raised, particularly around mental health and other issues. So we know, and we've heard throughout today, that there's an acknowledgement that communities of color, particularly Black and Latino communities, are bearing the brunt of the COVID-19 pandemic. COVID-19 is building upon decades of pervasive and systemic inequities that lead communities of color to have a higher burden of chronic disease, less access to health care, and ultimately shorter life expectancies. Unless we act swiftly and decisively to target every part of our pandemic response to these disparities, we will likely make them worse. Equity is not one of the many issues that we must tackle. It is the lens through which we must respond to this crisis. It's been stated already, but just as a reminder, Black, Latino, and Pacific Islander Californians are overrepresented both in our cases and in our deaths from COVID, but these numbers only tell a part of the story. Unfortunately, California is not currently reporting data on COVID-19 tests administered by race and ethnicity, which leaves a hole in our understanding of who has access and who is, how people are impacted. The two states that are reporting data on tests administered by race and ethnicity have found that Blacks and Latinos are vastly underrepresented in who is being tested, which means that what we're seeing in terms of cases and deaths likely significantly undercounts the impact that the pandemic is having on those communities. We don't only need testing at all in these communities, but we really need a concentration of testing in the communities that are most impacted. Senator Wiener discussed a study from the Mission District in San Francisco, which confirmed that the virus is more widespread in communities where residents have less access to accurate and timely public health information, less ability to shelter in place or self-isolate due to being low-income essential workers, live in crowded housing conditions, and do not have adequate access to protections such as paid sick leave. We've also seen data from LA that shows that tests are twice as likely to come back positive in low-income neighborhoods compared to high-income neighborhoods. So we really know where we need to focus our efforts, and we do appreciate some of the recent efforts by the state with the 80-plus additional testing sites, but we know that much more needs to be done. Not only do we need testing locations, but we also need to remove the barriers to testing. So the requirement that we have for some populations that you be referred by a doctor can be a huge barrier for communities of color who are less likely to have access to a usual source of healthcare to be able to get that screening and get that referral. We also, see that our drive-up testing sites can pose a barrier for folks who don't have a car. So we're glad to see more walk-up testing sites being opened. Interpreter services continues to be an issue that we hear about at the testing sites. And limited operating hours, because we know that testing needs to be available to folks when they get off work, when they're done, when they're going home for the day. One effective strategy that we do recommend is locating testing at established community gathering sites that are widely trusted. For example, in Alameda County, the Roots Community Health Center has been established as a testing site, a walk-up testing site that really focuses on services to formerly incarcerated individuals and is able to really provide assistance to that population. In addition, for both testing and contact tracing, our public education outreach must be much more robust. California has taken really important steps to make sure that testing is available free of charge and regardless of immigration status, but people need to know that. And what we're finding is that people don't necessarily know that. People are worried about the cost. People are worried that getting tested will impact their immigration status, and people are scared that receiving a positive test result will jeopardize their job. So we recommend using trusted community messengers to provide accurate and timely and culturally relevant information. Appreciated the conversation from LA County about the use of community health workers. I think that's a strategy that we definitely embrace and think will be effective. And then finally, I just want to say, when we think about testing and contact tracing, We really worry that those efforts will only be as effective as the ability that people have to self-isolate if they test positive or if they have been in contact with someone who has tested positive, which means that in addition to looking at how we're going to do testing and contact tracing, we really need to focus on strengthening our safety net. What we have today is not going to work for the majority of Californians who don't have the ability to work from home and who may not be able to miss work, who may not even have a physical location to self-isolate. So we really need to double down on building those social services that are going to be important in order to be able to control the pandemic. So in conclusion, this is a moment in which we must have an honest conversation about race and equity and take immediate action to protect all Californians. Thank you again for the opportunity to testify, and I'm happy to further engage with this committee at any time.
Thank you very much. Appreciate the presentation, very insightful. Great, so this concludes the two